I think that brings up a really interesting point how gender can affect how somebody either exhibits or deals with their mental health. And I think that same kind of difference can be extrapolated over differences in culture or ethnic backgrounds. This question is really for anybody. How do you think the FAA should accommodate for those types of differences and differences in background when it comes to mental health?
As an outsider looking in, it's hard not to take pause at, and again, I speak only for my opinions, not the opinions of others, that this where the conversation is starting based on background is very striking. Where pilots and pilot organizations are talking about where that starting point is very different than talking to regulatory folks and what they think about. Again, this is my opinion, no one else's. In when considering how we got here and why we're here, it might be helpful to think about it from the lens of a regulator. At the end of the day, the FAA reports not to pilots. It doesn't serve pilots ultimately. It serves the public. And in aviation across the world, or in the United States, it's exceptionally safe. And this is not my opinion, but one could make the argument: is there a problem here that needs to be addressed from a regulatory perspective? Now, I suspect there might be some people who say yes, a resounding yes, but the disconnect is the lack of data that clearly demonstrates a change how mental health can impact performance. And there's many facets to that, to include aeromedical redundancies, for example, two pilot operations, among many other aeromedical redundancies. But when thinking about it from a regulatory perspective, the gap is that there's not data saying that there's necessarily a safety thing. Now, people can make hypotheses, and what I said may not be popular, but you can certainly make hypotheses. But the definitive data saying that's the case, to my knowledge, doesn't exist. And so, from a research perspective, we are working very diligently to try to demonstrate, one, that it does impact, that my hypothesis is that it does impact safety. We know other factors such as sleep, stress, other human factors, things impact safety. But that's more of a long-term aim. From a short-term aim, I will say this: that while I think we look to the FAA and regulators to help us give the answer to this question, I'm not certain that the FAA is necessarily going to be the ones who are going to solve this issue, because that regulatory relationship, does this pilot meet the minimums? Yes, no, that's always going to exist, regardless of what those minimums are, because it's a regulatory organization. But these programs that we can intervene, that we can apply to our organizations, might bring value. And one thing that often comes up, especially in peer support programs in the airlines, and in at UND, that's wonderful, is that some people might say, I don't feel like I have the credentials, I don't feel like I have the training to help people navigate these issues. Keeping in mind what I'm about to say is for routine day-to-day mental health things, not necessarily for somebody with a diagnosed medical condition. But Lampert and colleagues in 2001 published in the American Psychological Association that of people who participate in therapy, what percentage of the benefit is specifically attributed to the methods, meaning like the technical skills? So you go to therapy, what percentage of that therapy is specifically because of how skilled the therapist is? It's about 15%. The major influencers is a therapeutic relationship, a listening ear, validation, and then appropriate boundaries. So I think there's creative ways we can address this, and part of that might be through these peer support programs for day-to-day preventative mental health, not necessarily for medical conditions.